It probably won't surprise you that axial joints have less range of motion than appendicular joints. The joints of the axial skeleton are very strong joints, permitting very little movement. For example, the atlanto-occipital joint. So this term refers to the joint between the atlas and the occipital bone. So these words are very expressive about where they are located. Joints of the appendicular skeleton, on the other hand, have a very extensive range of motion, but are often weaker. Examples are the sternoclavicular joint, an articulation between the axial skeleton and the pectoral girdle and upper limb, and the sacroiliac joint, which attaches the sacrum of the axial skeleton to the pelvic girdle. We are skipping section 8.7. We'll look at some issues with joints. An intervertebral disc disease, IVDD, includes herniated discs. So in a herniated disc, this inner nucleus pulposus bulges out and compresses the spinal nerve. Bones change with age. Osteopenia is lacking bone. There's inadequate ossification, leading to loss of bone mass. And this often occurs with age and is more frequent with women. Osteoporosis is bone loss, and here you can see a good shot of scanning electron microscopy of normal spongy bone and spongy bone with osteoporosis. With the loss of bone mass, along with reduced cushioning of the intervertebral discs, there can be a greater incidence of vertebral fractures in the elderly, and you can see this compression fracture here. The shoulder and hip are ball and socket joints. The shoulder joint, or glenohumeral joint, has the greatest range of motion of any joint in the body, and it's also frequently dislocated. And this demonstrates how its stability is sacrificed for that greater mobility. Articulation is between the head of the humerus and the glenoid cavity of the scapula. It is stabilized by 5 major ligaments, surrounding muscles and associated tendons, and the bursae help reduce friction. Here is a picture. You do not need to memorize any of the tendons, ligaments, cartilages, anything in this joint. The hip joint is a sturdy ball and socket arthrotic joint, permits flexion, extension, adduction, abduction, circumduction, and rotation, and the articulation is between the head of the femur and the acetabulum, which is this deep fossa of the hip bone. The hip bone is another joint you do not have to memorize. We do not have to know the elbow joint. The only joint you have to know in great detail is the knee joint. The elbow joint is a complex hinge joint involving the humerus, the radius, and the ulna. It's very stable. The bony surfaces of the humerus and ulna interlock, and there is a thick articular capsule that surrounds this, and there are very strong ligaments that reinforce the articular capsule. The knee joint, you have a need to know this. It contains 3 separate articulations, 2 between the femur and tibia and 1 between the patella and the patellar surface of the femur. These articulations prevent flexion, extension, and very limited rotation. The fibula is not part of the knee joint. The knee joint has supporting structures. So the quadriceps tendon, the knee of the thigh, is the quadriceps. The the muscle of the thigh is the quadriceps muscle. From that muscle to the patella is the quadriceps tendon. Tendon connects muscle to bone. The fibular collateral ligament or lateral collateral ligament. So you have to be able to look at the knee and know whether it is the anterior surface or posterior surface, whether it is the right knee or the left knee. Keep in mind the patella is always anterior and the fibula is always lateral. So this knee here on the left is a right knee. That fibular or lateral collateral ligament provides lateral support. The tibial collateral ligament or medial collateral ligament provides medial support. And in the back of the knee, the popliteal ligament runs between the femur and the heads of the tibia and fibula. The medial and lateral menisci, these are pads of fibrocartilage that cushion, and it's located on top of the tibia, so as the femur sits there, it's sitting on this pad of fibrocartilage. Inside the knee is the axial or anterior cruciate ligament and PCL posterior cruciate ligament. Some of the issues with joints include rheumatism, which is just a general term for stiffness. A lot of older people feel stiff in their bones and muscles when they wake up in the morning. It takes a while to get moving. Arthritis is all diseases that affect synovial joints, always involving damage to the articular cartilage. There are 3 types of arthritis: osteoarthritis, rheumatoid arthritis, and gouty arthritis. Osteoarthritis is also known as degenerative arthritis or degenerative joint disease, DJD, and it's the most common. It affects people older than 60, and it's caused by wear and tear on the joints as well as genetics. So with wear and tear, the joint will change. Here you can see normal articular cartilage with a smooth surface. Here you can see smoothness in this with this cartilage. This is inside the knee using arthroscopy. And here is the damaged cartilage. You might also see this damage on an X-ray, as the bones will be closer together with the damaged cartilage. So we can use that arthroscope to look inside at the damage to a knee. It's called arthroscopic surgery. During the surgery, they can remove bits and pieces they may be floating around in the knee and cut off pieces that maybe are shredded and need to be cut off. MRI, or magnetic resonance imaging, also allows us to visualize the soft tissue outside the joint cavity. And artificial joints are becoming more and more common, although this may be the treatment of last resort. Other methods before artificial joint replacement would be regular exercise, physical therapy, and anti-inflammatory drugs. New joints can last for 15 years. Shoulder joints, knee joints, and hip joints. Which of the following is commonly associated with vertebral fracture in postmenopausal women? Osteoporosis. What is another name for degenerative joint disease? Osteoarthritis. What part of the joint shows damage early in degenerative joint disease? Articular cartilage. Which of the following can successfully be treated with surgical joint replacement? osteoarthritis.